Good afternoon, and welcome, class of 2028, and honored guests of our School of Medicine community, to this special event recognizing our shared efforts in preparing our Wayne Warrior Physicians in Training. I'm Dr. Eva Wainio, your Assistant Dean of Student Affairs. Today is the capstone to your pre-clerkship phase and a key mile marker on the Highways to Excellence MD curriculum. Next week, you will step fully into the role of clinician, and you are surrounded here by those who supported your medical education to reach this point, as well as those individuals that will guide the next leg of your journey to becoming a physician. It will be a year filled with significant personal and professional growth. You will be part of a healthcare team that utilizes their shared clinical foundation and skills to help a fellow human being. You'll see the impact this makes on the patients and on those around them, including yourselves. And the next day, you'll do it all over again. Now, we fully recognize the great importance of your outside support and acknowledge friends and family joining us via live stream today. But in contrast to your white coat ceremony and other outward-facing ceremonies recognizing individual achievements with guests from afar, this event is focused on the educational commitment of the extended Wayne State community, starting with university leadership, our dedicated undergraduate medical education administration and staff, the extended basic science and clinical faculty, and our vast network of alumni. We will begin today's program with a welcome from Dr. Wael Sacher. Dean Sacher is a passionate medical educator. Over his 3 decades as a faculty, he has been an active participant in the teaching and mentoring of medical students, residents, and fellows. For the last 4 years, Dr. Sacher has served as the Dean of our School of Medicine. In that leadership role, he oversees the Office of Medical Education, the recruitment and evaluation of department chairs, and the recruitment and evaluation of School of Medicine-based center directors. He coordinates the many dimensions of the School of Medicine that contribute to your quality medical education and that impact your experiences as a student in the MD program. Please welcome Dean Sacher.
Thank you so much, Dr. Wainio, our amazing Assistant Dean for Student Affairs and Wellness. Give her a shout out, please. Congratulations. Myself and the faculty share your pride today as you embark on the next step of your training. I always like to remind you that you have been selected among thousands of applicants. I believe I was chatting with some of you outside in your particular year among 10,000 applicants. This year, as you may hear from our Dean of Admission, Dr. Harold, our applications reached a peak of almost 13,000. So with that said, you probably should always be proud of yourself as someone who embody the mission of the Wayne State School of Medicine. And we see in you the future physicians who are not only outstandingly qualified academically, but also the type of students we attract and graduate, students who have a deep commitment to the mission of medicine, to our communities, and yes, who qualify to be leaders in the field. As you heard Dr. Wainio, it is probably at this transition an appropriate time to acknowledge everyone in the faculty and staff and the entire medical school family who worked with you up up to this point. So especially for the faculty, for the preclinical phase of your training, we acknowledge them, and I would give them a round of applause myself, absolutely. As you bridge into your clinical rotations and hospital wards, I would like also to welcome our partners in this training journey. We have here leaderships of Henry Ford, of Ascension, of Corewell, the Detroit Medical Center. I am not sure, but we may also have partners from Trinity and the VA. Literally every major health system in Southeast Michigan is a partner of this training, something that enriches your experiences and something that Dr. Baker, and I would specify Dr. Chris Steffes, work very hard on making sure that all of you have a place in clinical rotations, and also that you not only benefit from that yourself, but you represent to these systems some of the best pool to recruit residents from. Therefore, the last week, also great event of a 99.4 match rate that have been achieved due to your excellence and the support of everyone, including medical education and especially student affairs. As you move into your clinical rotations, you will see new instructors. You will start working with multidisciplinary and interprofessional environment by which you're working with other physicians, you're working with nurses, with pharmacists, physician assistants, and very important not to forget, you will be working with people that you will learn from who do not necessarily wear the white coat. These are primarily your patients and your patient's family, who we know they will continue to be the focus of your attention and your skills. We're so proud of you, and we congratulate you on this great milestone, and we know that you will make us proud, just as you made us proud up to this point. Thank you, and enjoy this afternoon.
Thank you, Dean Sacher. Our commitment to community with you does not end when you receive your degree and on board for your residency across the country. From the moment you matriculate at Wayne and well beyond graduation with your MD in hand, you are part of our large network of alumni whose generosity and dedication to your education is phenomenal. It is therefore my great pleasure to introduce Dr. Rebecca Klisch-Hulbert, past president of the Medical Alumni Association. Dr. Klisch-Hulbert is an associate professor in the Department of Psychiatry and Behavioral Neurosciences, program director for child and adolescent psychiatry for the DMC Wayne State program, and an incredibly dedicated and committed alumna. Please give a warm welcome to Dr. Klisch-Hulbert.
Thank you, Dr. Wainio. Welcome, class of 2026. Oh, no, you guys are class of 2028. To the Wayne State University School of Medicine's Clinician Investiture. As Dr. Wainio said, I'm Dr. Rebecca Klisch-Hulbert, past president of the Medical Alumni Association and a proud triple grad of the School of Medicine. It is an honor to represent the Medical Alumni Association today. You are entering an exciting stage of your career. Education now becomes training. You've built a strong foundation of knowledge, and now you're finally going to get to put it into practice. This is what you've been working towards. Yes, it comes with the taste of bad cafeteria food, the smell of C. diff in the morning, and patients telling you're attending a completely different story than what they told you. Instead of lectures and textbooks, you'll be caring for patients, checking labs, performing procedures. It'll be challenging, but incredibly rewarding. You'll experience the fulfillment that comes from helping someone who has entrusted you with their health. Now is the time to grow beyond medical facts. You'll develop empathy, communication, compassion, leadership, teamwork, and professionalism. Embrace every experience. There's something to learn in all of it, even in the less glamorous moments. And remember, you're going to be supported by attendings, residents, nurses, classmates, and your patients. Wayne State students shine clinically. Program directors consistently note that our graduates function at the level of residents from day one, and I can attest to that as a program director. You'll encounter imposter syndrome. That's normal. You're learning, and it's part of the process. The good news, you'll finally have great stories to tell beyond how amazing the kidneys functions are. As you enter your clinical years, know that the Medical Alumni Association is here for you. We can connect you with alumni and specialties that you're exploring, even arrange dinners. If you pursue externships, we can help you find alumni hosts to save money. We offer career advice, mentorship, and sometimes even a shoulder to lean on. Whatever you need, we're here for you. On behalf of the Medical Alumni Association, we wish you success in this exciting new phase of your education. Thank you, and enjoy your afternoon.
Thank you, Dr. Klischelbert. Now it gives me great pleasure to introduce our keynote speaker, Dr. Paul Walker. Dr. Walker received his doctoral degree from Temple University and performed a postdoctoral fellowship in neuroscience at Rutgers University. He has been a full-time faculty member in the Department of Ophthalmology, Visual and Anatomical Sciences since 1990. Dr. Walker currently serves as the Assistant Dean of Basic Foundational Science at our medical school and leads our premier gross anatomy program. Please join me in welcoming Dr. Walker.
All right, it's been a while. So turn over your programs and draw me the structure of the brachial plexus. Label all the branches. You know, the funny thing is, I think they can. Student members of the class of 2028, I am truly honored to speak to you today as we mark this important transition of your training. And before I start, I'd like to take a moment to thank the many members of this class who gave their time and efforts to help educate their junior colleagues, members of the class of 2029, while juggling the demands of the M2 segment and even while you were on dedicated periods. Many of you volunteered to serve as near-peer educators, and I want you to be proud of what you've given back to our school and know how much these efforts are greatly appreciated. Medical education is truly a team effort. It's a partnership between faculty, administration, and staff, and of course, students. And it is our hope that you have recognized and experienced one of our primary missions, that is to train doctors to be teachers. And to be a teacher means that you are a seeker of knowledge, and not just a seeker, but also an effective communicator and an applier of knowledge. And while you will take advantage of technological advances in your practice, your success ultimately depends on your own human intelligence, your own motivation, your own professionalism, your own moral compass to guide your decisions. When I first spoke to you about the M1 curriculum way back in July of 2024, it seems so long ago, I put up a slide that showed the HBF challenge. Do you remember? Do you remember what the challenge was? It was to learn as much as you possibly can about how the human body is put together and how it works. Simple as that, right? Now, the possibly can part of the challenge was left up to you to determine. And yes, it depended on your own abilities and skills, but also on your motivation and commitment. And while you have been focused on your own success, rightly so, the actual stakeholders of possibly can are your patients. And when you think about what your future patients expect of you, and you compare that to a 70% course pass line, the difference between good enough to pass and possibly can is a chasm. Imagine a surgeon with a 70% chance of correctly identifying the splenic artery during gastric surgery. Your patients expect 100% accuracy. So when you reflect back, when you wonder why we held you to a higher standard, why we went beyond high yield, why we expected you to master details that you might have labeled as minutia, it was not to prove anything to us. It was for you to achieve your own possibly can for your patients. Now that you have finished the pre-clerkship curriculum, you've passed step 1, and you're about to enter clerkships. You're likely wondering what strategies will help you be successful. And I'm not really the one that can answer that question, but I know a few people. So I reached out to the class of 2026, who just matched, and I asked them to give some of their own advice. And I got a lot of responses back, too many to read today, but I grouped them into two categories. So I'd like to read you some of their comments that I heard several times. The first one is this: the most important thing is being a good teammate. This means being punctual and offloading burden from your residents. It means being professional, patient, kind, and being able to communicate effectively with both your team and your patients. It means taking constructive feedback in stride, exercising humility, and demonstrating your willingness to apply what you learned. Here's a quote from another student. Treat each opportunity as if it is your last, even if it is outside of your interests. Assisting in the delivery of a baby, or suturing a wound, or helping in the OR are all invaluable experiences. You'll be surprised what will fall into your lap if you are the student that asks, "Can I try that?" And you may have noticed certain words or phrases in this advice that you've practiced throughout the pre-clerkship phase. Things like, be a good teammate, be punctual, professional, patient, kind, and honest. Accurately communicate with both team and patient. Listen and learn from constructive feedback, and exercise humility. And demonstrate a willingness to step forward and apply what you have learned. And you know something? This isn't new. You've been hearing this type of advice probably all of your life. You've heard it from your parents. You've heard it from your teachers, coaches, and mentors. Be a good person. Give it your best. Give it your possibly can. Members of the class of 2028, I have really enjoyed working with you, and I'm honored to have been a part of your journey to become a Wayne-trained physician. Thank you.
Thank you so much, Dr. Walker. Those are incredibly important words of wisdom. You are an exemplar of professionalism we can all aspire to, and I think that's why the class of 26 that just matched voted Dr. Walker to be the class marshal, which is the most impacting person during their education, and he will lead the class in procession on commencement day. So I think that speaks volumes to what Dr. Walker's impact is for them, but also for the class, Dr. Walker, that's sitting right in front of you. So thank you for that impact that you've had on them. And I think setting that foundation in gross anatomy is really transformational, where you start becoming not just a medical student, but you kind of transform and you start that process into becoming a distinctly Wayne-trained physician, as you ended on. That was a great lead-in. So I want to just acknowledge that this capstone event really makes a key point, is a key part of that process. And that's why we're assembled here, if you will, today, to just re-highlight, sort of revisit those ideals and those pieces of that. So investiture seems like, you know, where did that name come from, right? Like it's kind of like a white coat ceremony, we all get that, but investiture is kind of maybe like we think of a very ceremonial installation to a high office, and we're gonna have one next week here, or this month sometime for the new president. He's gonna be invested. He's gonna have his investiture for becoming the president of Wayne State University. But really when you look at the Latin root word for vestus, it means robe, and when you add the preposition in, it means to be robed in. And that means to bestow an authority and a responsibility. So that all happened to all of you wearing those white coats on white coat ceremony day. That was 2 years ago when you were all officially robed with the white coat you're wearing today. But today, you will take on the professional responsibility of a clinician sealed with an oath. And Dr. Baker will administer that in a little bit. On the wards, you will become representatives of our school and the medical profession, and that is how your patients will see you. I'll tell a brief story about when I was a resident, my program director got very sick. And he was a very stately, tall, like impressive man, very kind. He had all those attributes we just heard about. And he became very, very ill, Dr. Battle. And we all looked up to him as residents. And he was admitted, and we found him on our patient list the next one morning. And we were like, Dr. Battle, it's got to be a mistake, and he was on our patient list. He ended up going to the intensive care unit where he stayed on our patient list. He wanted us to take care of him. He wanted his own residents that he was still training to be his doctors, and that spoke volumes to me for the rest of my career, really. And what it told me is that he believed in what he was instilling in us. He believed in what we could do, and I think that's where we are with you today. We really believe in our, I don't even want to call it a brand, but we believe in what Wayne State can do for you, what the Wayne trained brand, if you will, and you will be that kind of physician. I know when I look for a doctor, I look for a Wayne trained physician, and I have not gone wrong with that since then. So our School of Medicine being 157 years old is really steeped in history. It's rich with experience that we can draw from to distill out the essence of what does it mean to be a Wayne trained doc. We kind of know one when we see one. You heard that program directors are looking for you, and they will be in just a couple of years from now. But a little later in the program, Dr. Steffes will tell you the backstory of how those 16 C's, as we've come to know them, how those came to be. But right now, I want to invite a couple of our student leaders to tell you from their perspective what that entails. The first one is Brendan Dolan. He's the president of the Alpha Omega Alpha Honor Society, and I want to ask Brendan to come up now and share his perspective. He was right in your seats last year.
All right. Thanks, Dr. Chadwell. Hello, class of 2028. I would like to reiterate the many congratulations that have already been expressed to you. I think that being in the seats that you're in today is a big accomplishment that deserves recognition in its own right. And so in preparation for the speech today, and just for a little bit of fun and some perspective, I went back and did some calculations and discovered that to this point in your training, you have completed 495 lectures. You have taken 24 Wayne State proctored exams, and you have completed what is probably the most robust of the licensing exams in our training in step one. and you have done all of that in about 20 months' time. So certainly an accomplishment in its own right. Now, as you prepare to enter third year, you are entering what will probably be the biggest transition point in your 4 years as a student here at Wayne State. Contrary to the way that you're trained during your first and second years, when you finish interviewing your patients in third year, they typically aren't going to provide you with a multiple choice list of possible solutions to their problems. And I've still yet to hear a patient with a subarachnoid hemorrhage come in and complain of a thunderclap headache. So certainly there will be some adjustments that you'll have to make as you enter third year. I think one of the biggest adjustments that you will make, and you will learn very quickly, is that medicine is very much a team sport. And while in your first and second years, you can kind of exist as an individual entity, that will not be the case in your third year. You will be part of a medical team that is depending on you to fulfill an important role. And I think that it can never be stated enough that at the center of this new team that you're joining is always the patient. Whether you believe it or not, sitting here in these seats today, each and every single one of you will profoundly impact the lives of at least one of your patients during the year ahead. And I know that the challenges that third year presents can be difficult at times, and certainly at points you may feel overwhelmed. But I want to encourage you all to persevere, knowing that the impact that you are having on your patients is probably more than you realize or are willing to give yourself credit for. I urge you to avoid going down the easy path of complaining or taking shortcuts. Rather, allow the strength of your patients and their dependence on you motivate you through times of difficulty. Do not lose perspective that it is a tremendous privilege to share in the lives of your patients during some of their most vulnerable moments, and it's a privilege that you have all earned with the work that you have put in to get here today. Going back to the idea of medicine being a team sport, during your third year, you will be surrounded by incredible teammates. The physicians that you will have the opportunity to work with during your third year, and many of whom are sitting on this stage today, are some of the most incredible and committed people that you will ever meet in your lives. They have completely dedicated themselves to the betterment of their patients and also to train the next generation of physicians in you and I. So allow yourself to be motivated by the abundance of good that you will see from them in your third year, while also not being afraid to take note of how you might do things differently when the time comes for you to be in the shoes of the attending. While I certainly don't view myself as anyone that's qualified to be giving advice to a group as accomplished and talented as yourselves, I do have one idea that I would like to leave you with today that has really helped me a lot in my own life through times of transition or uncertainty. And it is the philosophy that everything you need is already inside of you. When I think about this quote, it provides me a sense of peace in knowing that the tools that I need to succeed are already in my possession, sometimes without me even realizing it. During the year ahead, you will be repeatedly thrust into new and unfamiliar territory and just asked to figure it out. While this may seem like an intimidating task, I'd like to remind you that you have already proven to yourselves that you can do it. You all started school here a little over a year and a half ago without knowing much of what to expect at all. Many of you were moving to a completely new city for the first time, didn't know anyone here, and you really had to adapt and overcome. You found a way to digest and consolidate massive quantities of information while adjusting to an entirely new way of learning. You conquered new and unfamiliar challenges like anatomy lab and CEC. You even learned and then immediately forgot the Krebs cycle for like the 5th time in your life. All this to say, you showed grit, resilience, and an ability to collaborate with those around you to face adversity head on. It is these same skills, the ones already inside of you, that you will employ again during your third year and beyond to have continued success. Take comfort in knowing that everything you need already lies within. And lastly, on behalf of the class of 2027, we will be sharing many of the same clinical sites with you as we enter into our fourth years. And I just wanted to share with you that you can view us as obviously friends and peers. The class of 2026 did an incredible job of kind of showing us the ropes. And so I hope that you look forward to seeing us as familiar faces when you start your clinical sites. And I wish you all the best of luck and look forward to seeing you all thrive in the year ahead. Thanks.
Thank you very much, Brendan. I now invite Ms. Kia Sweeney to the podium, our president of the Gold Humanism Honors Society. In this role, yeah, go ahead. And it's something that you can all become part of, and she can tell you more on that. But in this role, she led the organization to carry out its mission, which is to foster and celebrate humanism in medicine, a compassionate approach to patient care, the well-being of providers, compassionate and advocacy for holistic care. She has exceptionally strong leadership because she's also the co-president of the Asclepian Honor Society and the BMA. And she matched in psychiatry a couple of weeks ago. So welcome to the podium.
Thank you for those kind remarks. Hi, everyone. I am very grateful and excited to be here. I actually consider it a privilege that I was invited to be able to speak to you all, because you're all amazing. As you're transitioning into your third year, I remember this very vividly, and it's where my own dreams of wanting to become a doctor actually became a reality. So it's such an important time in your lives right now. So I'm hoping to convey a few things that will maybe, resonate with some of you all. You'll remember a couple of things. So one is, I really think that this is a time to safely encourage your own personal growth and reflection. It's a time where I hope you'll start to feel a little bit more confident, because I know we can be scared. And then it's a time where I'm hoping you can show up as your authentic selves. Use this time to leverage your own strengths and acknowledge if you have some areas that need improvement. None of us are perfect. I am certainly not perfect. It can be so tempting to compare yourselves to the person next to you, but please try not to do that. Instead, be inspired by them, motivated or encouraged by them, and then gently remind yourself that you're here because you want to become the best clinician you can be so that you can take the best care possible of your patients. So whatever challenges you may be facing, like right now, because we all have them, ones you may have faced in the past or those to come, I want you to try to work through it. Whether it's academic, health-related, or something else going on in your life, please try to embrace it, learn from it, grow from it, and whatever ends up happening, remember that what you're going through could help someone sitting next to you or someone you may help in the future. Don't be ashamed to ask for help when you need it. I had to learn that. It was super hard to ask for help. There are so many people who will help us. I've personally benefited from many people that's like sitting in the back, out in the lobby, on the stage. They've all helped me, seen me in various different stages of my time here at the School of Medicine. But please lean on your counselors, your mentors, or others who may refuel you when you're feeling depleted. And then I just want to remind you that you have a unique opportunity to really cultivate and find your own superpower. I know that may sound corny, but for real, there is something about you that only you do, that no one else does like you. Maybe it's connecting with patients, interpreting labs or images. I really believe that you have something special, and I'm hoping you can find out what that is third year. Really let this guide you, okay? And be honest about what you don't enjoy. And then whatever you do enjoy, run towards it and let go of any preconceived notions you may have had about what you were supposed to enjoy. Pay attention to how you show up, how you communicate with others. Being respectful, caring, and considerate and compassionate, it all really matters. And that's actually why I'm here today, representing Gold Humanism Honor Society. It's an organization that values all the things that I just talked about. And all of you are going to be eligible to be nominated for this organization in the fall. And those that are nominated will be eligible to apply. And then then only 15% of you are going to be selected. There's other opportunities in the future as well, but it's going to be an incredible opportunity to serve as an example in our community and be a leader in clinical excellence and prioritize the human element of medicine. We can be so tied to like Anki and UWorld, all of that, but the person in front of you actually really matters. So to wrap this up, I am extremely grateful that I even made it here to be a clinician, to be 2 steps away from being an MD myself. And it's been a faith journey, a resilient journey, and I'm hoping that you all will have opportunities to display all of the incredible things that are unique about yourselves. And I just want to thank you for listening to me today. And if you don't remember anything else that I say, I want you to try to give yourself permission to flourish. Really allow yourself to become who you were meant to be and value this time. Thank you so much.
Thank you very much, Kia. So when you came into the auditorium, you found your seats with your Warrior House classmates. Most of you were strangers. Remember that first day in Scott Hall, we had you sit with the colorful tablecloths and that? And we said, you might meet your best friend here, you might meet your spouse here, you know, all kinds of things can happen, and they do. But since then, you've spent a great deal of time together, right? In CBLs and PBLs, gross anatomy dissections, handoffs, group service projects, and special outings with your housemates, forging bonds of friendship and collegiality. Your house is designed to be a community where you can thrive throughout medical school. We just heard about flourishing, and this is meant to help you do that during medical school. So we learn in community, and our next guest, Dr. Eric Ayers, leads that charge, and he will share his thoughts on this important aspect of your training, continuing into M3. We don't want it to stop here, even though you'll be even more busy. He received his medical degree at Wayne State School of Medicine, Wayne trained Dr. Ayers, and completed his combined internal medicine peds program residency training at the Detroit Medical Center. Please help me welcome Dr. Eric Ayers.
Welcome and good afternoon. I am going to do something that some of my colleagues know is hard to do. I'm going to stay to my script, which is which is not a usual thing I do. Today is a milestone, not just a ceremony, but a testament to everything you have poured into this journey. From the moment you walked through the doors of Scott Hall, you became something more than a medical student engaged in learning medicine. You became part of the Warrior House community, discovering the power of engagement and how it fuels both personal and community growth. You became part of the Wayne trained community, and that membership will carry you far beyond these walls. Look around, really look, because what you see is nothing short of remarkable. You did not stumble into this moment, you chose it. And I want you to remember that as you go into the clerkships, because there will be moments when you'll say, why, what, who, but remember, this is your choice. Therefore, you got to stand up and do your best. And I bet if you had to choose it again, you would choose this road journey and road again if you had to go and make that decision again. Even when the path was unclear and the pressure was relentless, you will still choose this road. Why? Because you wanted to be a physician. You are going to make hard decisions. You're going to make hard sacrifices. You will sit at times with uncertainty and still show up to the next morning ready to learn, ready to serve, ready to grow. You will survive the highs and lows of integrated curriculum, not only from the basic science, but the intercurriculum that you'll learn during the clinical clerkships. You have learned from the exams that shook your confidence, and boy, do those exams shake your confidence at times. You've endured CEC, and you've learned from service learning. You moved into your core, the clinical clerkships, in the days when academics, family, and the weight of the world all seemed to be troublesome but bearable. And through it all, you never truly were by yourself. You weren't alone. You had a community. This is because what was built long before you arrived. Over 10 years ago, the learning communities, or the houses, were established, not as a program, but as a foundation, brick by brick, class by class. They have become woven to the very human architecture of the medical school. They are part of what holds it together, and that same sturdy, time-tested foundation became the glue and is becoming the glue that holds you together as a student, as a class, as part of the houses. Forging bonds no exam can measure, real friendships tested by struggle, built in the trenches of becoming an excellent student clinician. That foundation does not crack when you leave this room. As you enter the clinical years, lean on your houses, lean on your classmates. The people beside you today have already walked through fire with you, and they will show up if you ask them to. Check on them. Let them check on you. You are far stronger together than you will ever be apart. To our house coordinators and peer mentors who sit in this room right now, you helped lay that foundation, one student at a time. You matter more than you know, and to that I say thank you. Let medicine guide you, not break you. Let it reveal the strength that you do not know you had through service, advocacy, humanism, and professionalism. Remember the why and the who of your mission, because that is the very message the houses have been speaking to you all along. You are capable, you are needed. I ask that you continue to rep your house even though in your clerkships, because we need your feedback, your voice, and your inspiration. Honor the legacy and carry with it the pride, what it means to be warrior-trained physicians. Thank you. Now I'll introduce Brianna Reagan, who is a M4, who has been through this journey of being a peer mentor, a house coordinator, serving on the Student Senate, recently matched in anesthesiology at her home school of U of M. Brianna.
Thank you, Dr. Ayers. Hi, everybody. I want to start off by saying a huge congratulations to sitting here and making it this far in your training. This is where it starts to get real. You're going to now take all of this hard work, this learning, this knowledge that you've gained over the past 2 years, and you're going to have absolutely no idea what to do with it. That's okay. It might feel like you don't know what you're doing at first, but you'll get there. And while you'll learn more than you ever thought possible as you move through your clinical training. You may not feel it, and you may not see it from day to day, but by this time next year, you'll be amazed at how far you've come. During this transition, trust the process and remember to give yourself grace. This is a steep learning curve, and that's okay. You're working alongside individuals who have spent 10, 15, 25, 35 years sharpening their skills and their knowledge on a field that you're being asked to learn in the matter of just a few weeks. The support systems around you matter. The ones that you've built over the past 2 years, your friends, your classmates, and yes, your house community, they will continue to be key to your success. Ask a million questions and do not hesitate to ask for help. You have 2 superpowers at least that you can use as med students. You have the ability to ask questions that others might be hesitant to ask. Your residents will thank you, so please ask them. And you also have the time to truly connect with your patients in a way that maybe your residents or your attendings also do not have the privilege to do. So use those strengths, embrace the relationships that you've built with both your colleagues and with your patients. I could not have made it through my rotations without the people around me. Even when it doesn't feel like it, as mentioned, medicine is a team sport. So channel some of that M1 enthusiasm that you had during Olympics and make each other better. The Wayne State community is here to support you. The houses are here for you. Your peers are here for you. And the faculty and the alumni network are here for you, as you've heard. So don't be afraid to lean on one another as you move forward towards your goals. Congratulations and take a breath. These next 2 years will fly by, I promise.
Thank you, Brianna. For the next part of our program, we would like to look back in time and look ahead to the next phase of your medical education. To take us through a brief reflection, we will be joined now by Dr. Rodney Braun, well known to all of you from your pre-clerkship phase. Dr. Braun is an associate professor in the Department of Ophthalmology, Visual and Anatomical Sciences at the medical school, and a recognized leader in medical education. He serves as director of medical histology and embryology and co-directs several pre-clerkship courses. While his current focus is heavily weighted towards education, Dr. Braun also maintains an active interest in ocular and physiological research and provides substantial service as the co-chair of the Curriculum Management Committee. Please welcome Dr. Braun.
All right. Yeah, thank you, Dr. Wainio, and good afternoon, class of 2028. So I want to just take a few minutes this afternoon to reflect back on your pre-clerkship experience here at Wayne State. So I can remember actually meeting some of you way back in July 2024 when you were just starting out. And like previous classes, many of you were anxious about starting the curriculum. Of course, you eventually found your way and fell into the routine of medical school. So, anatomy labs on Tuesday and Thursday afternoons, histology labs on given Wednesdays and Fridays, and so on. You also got to know each other, and I would venture to guess that some of the members of your anatomy or histology groups are now close friends of yours. You might still remember sitting together as teams and calculating the specificity during EBM small group, or trying to locate the ischioanal fossa in anatomy lab, or perhaps even trying to pick out lacunae in histology lab. You've come a long way since then and have worked hard. And now you've passed step one and are ready to enter the clinics. However, our goal in the pre-clerkship curriculum was not just to prepare you for step one. We taught you foundational knowledge that you can use to critically read and evaluate medical literature so that you can make decisions based on reliable evidence. And that really is the foundation of evidence-based medicine. Unfortunately, we are living in a time when the principles of evidence-based decision-making are being questioned. For example, and I think this is a well-known example, despite overwhelming evidence that vaccines are safe and effective, vaccination rates have been dropping in the US with major health implications. After averaging 69 measles cases per year in the early 2000s, this year, there have already been 1,575 cases reported in just 3 months. And this increase can be attributed to lower MMR vaccine coverage, so measles, mumps, rubella vaccine. And that's around 92% nationally, roughly. So this might not surprise you, given the vaccine hesitancy among the public. But I want to give you some other data that's much more disturbing. Okay, and in a study published in 2022, 10.1% of primary care physicians do not agree that vaccines are safe. 9.3% do not agree they are effective, and 8.3% do not agree that they're even important. Okay. Among physicians who graduated after 1995, only 84% believe that the MMR vaccine is safe. So actually, evidence-based medicine is not universally practiced among current physicians, and the trend seems to be getting worse. So we included EBM and self-directed learning opportunities in the curriculum to teach you to critically read and evaluate the literature and to follow best practices based on current evidence. And we sincerely hope that you continue to enhance your knowledge and hone your skills in applying evidence-based medicine as you progress through your clerkship years. The rest of the pre-clerkship faculty and I wish you all of the best moving forward. And we have every confidence that you will become exemplary Wayne-trained physicians who compassionately care for your patients using the most current evidence-based medicine. Thank you very much, and good luck moving forward.
Thank you, Dr. Braun. Now, to help us look forward to the clerkship phase just ahead, I'd like to introduce Dr. Lynn Smitherman. Dr. Smitherman is an associate professor of pediatrics at Wayne State University School of Medicine and serves as vice chair of medical education for the Department of Pediatrics, where she leads educational initiatives and oversees the pediatric clerkship. Dr. Smitherman earned her medical degree from the University of Cincinnati College of Medicine and completed her combined internal medicine and pediatrics residency, as well as her chief residency in pediatrics at the Wayne State University affiliated hospitals. Without further delay, please welcome Dr. Smitherman.
Good afternoon. And first of all, I have to say, you guys look amazing. Give yourself a round of applause, because I love the white coats. Seeing you in your white coats, ready to embark on the clinical portion of your medical training is just awesome. And all of us up here on the stage are just so proud of you. You've worked with simulated patients, practiced your history and physical exam skills, you've nailed step 1. Now it's time to put those newly minted skills to use. Beware, however, because now you're going to confront real patients. And sometimes they go off script. So whether your patient is 3 or 83, obtaining an H&P can be entertaining and challenging. And sometimes it might take more than the 20 minutes that you're allotted to do so in the clinic. But you will learn sometimes that you just have to go with the flow. So I just wanted to give you a few pointers of how to navigate the next couple of years. Number 1, as was said before, approach each clerkship as if it's your life mission. If you want to be a big toe specialist, that is perfectly fine. That's good. Do you. However, think about it. The next year might be the last time that you see the inside of a living human body during your surgery clerkship. Or the last time that you catch a baby fresh from the womb and hand her over to her parents during obstetrics. Or see how a patient with sepsis responds to the appropriate antibiotics on internal medicine. Or assist in a trauma code in the emergency department. So you have lots to look forward to, so embrace it. Even if you're not interested in that particular area, go for it. Number 2, you will learn so much from the residents, fellows, and attendings that you will work with over the next 2 years. Watch them. Think about those clinical skills that you admire and emulate them. For example, on one of my pediatric rotations, I had an attending that treated each child as if they were their niece or nephew. And you could see how he was really able to respond and react and put all of his patients at ease. And that's one of those things that I like to hold with me every time I encounter a patient. The other thing is that you're going to learn valuable lessons from other members of the healthcare team. So when you see a social worker or physical therapist or dietitian go into the patient room, follow them and observe their approach to the patient. And then finally, at the beginning of each clerkship, think of 1 to 2 things that you want to master, whether it's how to manage hypertension in a patient with type 2 diabetes, that might take a while, or mastering the evidence-based immunization schedule, or recognizing the signs of clinical depression. Focusing on a specific skill will make your clerkship more meaningful. And let your preceptors know. Just throw it out into the universe. When I was on a pediatric cardiology rotation, the first day of the rotation, the attending asked all of us, what do we want to learn? And I said, I want to hear a diastolic murmur. Now, this particular attending was known for his scowl and his frown and his usual unpleasant disposition, but I just threw it out there. And he said, oh, those are so rare. You probably won't hear that over the course of your rotation. I said, okay, fine. Within a week, I got a call from a different attending in the cardiology clinic telling me to come on down because he had a patient with a diastolic murmur and he heard I was interested. So I ran on down, and it's one of those things that I'll never not hear again. It was absolutely amazing. So it's important to take advantage of all the learning opportunities that are afforded to you, because sometimes they'll just fall into your lap. So in closing, you will learn so much this coming year. You will learn how to balance studying for exams and perfecting your clinical skills. Embrace the experience. And I look forward to seeing you all in pediatrics. And please bring your white coats. Thank you.
Thank you, Dr. Smitherman. I would now like to welcome to the podium Dr. Christopher Stuffus, our Associate Dean of Clinical Medical Education. Dr. Stuffus is a general surgeon who has been a faculty member of the Department of Surgery for more than 30 years. He joined the Wayne State University faculty in 1993. He has served as professor in the Department of Surgery since 2009 and was the Year 3 Surgery Clerkship Director from 1997 to 2017. He earned a bachelor's degree in electrical engineering in 1982 from Cornell University and his medical degree from the University of Wisconsin-Madison School of Medicine in 1986. His general surgery training was at Wayne State University, Detroit Medical Center. Please welcome Dr. Stuffus.
Thank you, Dr. Wainio. Can you guys hear me all right? All right. You know, I've been taking some ribbing from some of my internal medicine friends over here to my right that about the irony of a surgeon talking about the role of the stethoscope in medicine, because what surgeon has a stethoscope? But I will tell you that when I was 20-some years ago, when I was deployed to the desert, the second thing I did was go down to the medical store that used to be across from Harper Hospital and bought myself a new Littman cardiology stethoscope, because I knew I probably would need one in a place with limited resources. And I did end up using that one. I had them before, but you know, I kept losing them. Stethoscope is important, even to surgeons, Dr. Smith. I've been asked the question, why are we here today? I don't think I'll get anything out of it. Who demands our presence at an event for there will be 0 questions on step 2? For this, I have a ready-made answer. Your bosses require it, your patients. As you are becoming a physician, your patients are now your bosses. You can complain about them. We all do, kind of, with our bosses. Not currently, but in the past. But we have no higher responsibility than to serve them, our patients, and act in their best interests. As the group The Who sung many years ago, you have a new boss, but it's not the same as the old boss. This is a boss who requires a slice of you and a slice of your life every day of your career. So who requires you to be at this event? To be on rounds in the clinic, in the emergency room as you learn to become a physician? Your patients require it now and in the future. Recently, there have been some discussions, and I read one of them in the Journal of the American Annals of Internal Medicine last month, regarding the imposition of the term provider in lieu of physician. This has been done by those seeking to maximize profit margin by substituting cheaper labor to fill out the electronic billing record by genericizing. There's a difference, though. Physicians, and I do include nurses and physician assistants in this, have a connection to the patient that a provider, as that term, does not. A provider is hired by a corporation to fulfill a service obligation. A physician, as a professional, has an ethical onus, a personal connection, a moral duty that goes beyond a transaction. This is a profession. Although there are certainly fees for care that are necessary to fund a system of excellent medical care, this is not and cannot be the direction, the verve, the raison d'etre for the care of our patients. It has to be more, the connection to the patient, as the patient puts their trust, their hope, their health, and oftentimes their life in your care and in your hands and under your knowledge and skills that you have learned. This is the purpose of the year that you are about to embark, learning to connect with your patient. Your first connection to your patient will be symbolically, metaphorically, and physically, and in actuality, the stethoscope. The pin that you received on the way in will remind you of this. If you share my experience, the expensive stethoscope will continually be stolen as you were in the resuscitation bay at Detroit Receiving doing open cardiac massage. That's why I had to go buy a new one. The pin and the metaphor will stay with you. As we get ready to take our professionalism oath that will guide us through our clinical years of medical school, residency, and lifelong careers, I would like to briefly think about the stethoscope that you will be using. What is the meaning of that? What does it represent? René Laennec of Lennox cirrhosis invented the stethoscope in 1816 as a way to politely listen to the heart, lungs, and great vessels. Stethos, chest scope, to examine. The stethoscope is our connection to the patient, our way of hearing what is going on inside. The early model was a very short wooden tube that had a trumpet at the end that we used to get close and listen to the chest. The modern stethoscope, thank goodness, has tubing that allows us to maintain our professional distance while still connected to the patient. Continuing this metaphor, even as we are listening to the intimate details shared by our patients, the anatomy and physiology of their disease, we also need to keep our professional distance to maintain our objectivity. The development of the stethoscope in revolutionary Europe marked a revolution in medicine. In the 18th century, physicians relied mainly on their patient's story to make a diagnosis and would do so by letter, early telemedicine, I guess. If they had an EMR, they probably would have just checked Epic to get the history. But the stethoscope changed all that. Back then, medical school was only lectures. It was not necessary to see patients, only learn from the experts. Only us barber surgeons touch patients. The stethoscope changed that. Physicians and students saw and examined patients daily, and the practice of medicine became more scientific, more empiric, and more personal as physicians tried to figure out what was going on inside the body, rather than just what humors were out of balance. Students recorded the findings in the paper charts. Of course, this was the start of student clerkships, and that's why you called student clerks. You used to write everything down. There is still that temptation to treat patients remotely, though. Whether over a Zoom link, reviewing the charts on the EMR outside the exam room, or just making diagnosis and treatment plans, looking at their CT scans without seeing the patients at all. Patients are worried that their doctor does not examine them, but the stethoscope takes us back to the patient. Even in modern practice, the stethoscope is our tether to maintain our connection to the patient. It is also the stethoscope that allows doctors to hear life. As Aristotle said, life is movement, and where we hear air moving, heart valves closing, diastolic murmurs, and blood swishing, we know there is life. We rely on our stethoscopes to listen to a newborn baby's breath sounds, to tell when we successfully obtain an airway in a critically ill patient, to listen for the flow of blood when assessing blood pressure. At the end of life, when we hear nothing out of our stethoscope, we pronounce the patient medically dead. So although we have many more accurate modes and specific modes that we use in assessing diseases of the chest, we would never think of representing a patient without a stethoscope. It is the icon of our profession. Now, as part of our profession, we have oaths to remind us in times of trouble. In your handouts, in these nice folders with these smartly laminated lists that you have, suitable for framing, in this, you have a professionalism oath that we'll recite in a moment. On page 2 of this, there's a list of the Wayne Warrior, MD, Physicians in Training Principles of Professional Identity. Try and say that 3 times. These are principles of professional identity. They were developed by a Wayne State Committee led by our former dean, Bob Frank. The committee reflected on outstanding physicians who were thought of as consummate professionals, and then wrote down the words that described them, descriptors that were fitting for all Wayne-trained physicians. There are 16 adjectives, all starting with a C, and it would seem that this was contrived as a gimmick of alliteration. But when you look at them, it is a coincidence of Latin roots that these words describe the physician who excels at a professional relationship with the patient. Most of them begin with CO or COM, using the Latin word, the Latin root meaning together with. Compassionate, competent, committed, conscientious, compliant, collaborative, confidential, community, collegial, considerate, communicative. all describe a relation of a physician together with the patient. The patient-physician relationship described by these words has no better symbol than the stethoscope, which allows the ears to listen to the heart. Finally, the Latin root for heart is cor, C-O-R, which is the root of our last descriptor, courage. It's useful to note that commercial, another word beginning with CO, is noticeably absent from that list. So in return for the prerogatives and rights granted to by society to physicians, the profession of medicine publicly professes its values. You're professing these values in this oath that we are about to recite. Carry yourself with the guiding light of these principles of professional identity that you see before you. Post them on your refrigerator if you have a magnet, or take a picture, put them on your home screen. Review them daily, and when you're having doubts and difficulties through this year, when conflicts arise, think first what your current and future patients would want you to do, and then return to this list. Let them be your guide to your daily connection to your patient and your dedication to the profession of medicine. Thank you all for listening.
So now Dr. Baker, Senior Vice Dean and Vice Dean for Medical Education, will now lead the class in the recitation of the Pledge of Ethics and Professionalism.
Okay, a man that needs no introduction. So in defense of, to your primary care colleagues, so in defense of my surgical colleagues, I will say surgeons do have and use stethoscopes. Now, when you're a microsurgeon, that stethoscope might be really, really, really small, but that's okay. I'm an ophthalmologist, microsurgeon. Okay, so this is probably the best part of the day. I'm going to actually ask you to do something. So I'd like all of you to please rise. I will begin by reading the first line of the pledge, and when I finish, you will repeat it as a class. It's a pledge of ethics and professionalism. I publicly acknowledge and accept the privileges and responsibilities given to me today as a physician in training and dedicate myself to provide care to those in need. I will approach all aspects of my education with honesty and integrity, embracing opportunities to learn from patients, teachers, and colleagues. I will certify only that which I have personally verified, and I will neither receive nor give unauthorized assistance on examinations or clinical reports. Okay, and I will emphasize the I. This is you. I will respect the humanity, right, and decisions of all patients and will attend to them with compassion and without bias. I will respect the humanity, right, and decisions of all patients and will attend to them with compassion and without bias. I will strive to earn the trust my patients place in me and the respect that society places upon my profession. I will recognize the privileges afforded to me as a physician in training and promise not to abuse them. Knowing my own limitations and those of medicine, I commit myself to a lifelong journey of learning how to cure, relieve, and comfort with humility and compassion. I acknowledge the principles of professional identity as reflected in the competencies uniquely set forth by the Wayne State University School of Medicine and will maintain the highest standards of professional conduct. I make these promises solemnly, freely, and upon my honor. I make these promises solemnly, freely, and upon my honor. Thank you, and be seated. Dr. Chadwell.
So this is a great opportunity to have a class photo. So I'm going to ask Matt Guerin to do that before we close out.
And on 3, 1, 2, 3. Thank you. Congrats.
All right. Okay, we're almost done. Now you can sit just for 1 second. So thank you, Dr. Steffes and Dr. Baker, for your contributions to the program. It's always good to go back to history, but also good for us to take the oath again and to revisit our commitment, our own commitment to our profession and to our patients right alongside with you. That's really meaningful for us as well. So I want to thank you, class of 2028, for your attentiveness. I know that was a whole parade of speakers and advice to digest, but we hope that you take what was meaningful to you and spoke to you and take that with you for this coming year. So we want you basically to walk away with, to provide compassionate care, collegiality, scientifically excellent care to your patients as you transition to the clerkship phase of your medical education. Before we conclude, I just want to shout out a heartfelt thank you to my staff who worked really hard behind the scenes to make this a really special day for you, to end your pre-clerkship. They're standing back there. Also, Matt Guerin, who is our historian, photographer, Mike Crimmins, and the other Mike back there. Yep. Thank you. And lastly, your family and friends that joined us online. I hope this also was a good way for you to share in this special day for your physician in training as they embark on this very next journey. Please enjoy the rest of this day, and God bless you for the start of this clerkship year.